noradrenaline, then it is converted to adrenaline. So the adrenaline and isoprenaline, but not norepinephrine, are potent bronchodilators. So adrenaline and isoprenaline are potent bronchodilators, whereas the noradrenaline is not. So this action is also marked when bronchi are constricted. So in case of asthma, there is bronchoconstriction, whereas at that time you can administer adrenaline and isoprenaline. But please seek that there will be increased blood pressure also. At that time you should see that force of the myocardial pumping and also the rate of the heart will be increased. So whenever if you take care of one organ, then there is a change in the other organ, because the total receptor subtype is totally different from that of the heart and bronchiole. So you have understood. So adrenaline is given by aerosol, additionally decongest bronchial mucosa and action. So if you are an asthmatic patient, then you can understand this very well, because you are suffering from that particular disease, and some of the time, many times, the sprays like salbutamol, albuterol, and ephedrine, so all these are given. If the spray is given inside the mouth, which enters the trachea and acts on the beta-2 type of the receptors, and it is going to relax the bronchi, and immediately you will feel relaxed, whereas your heart rate is going to be increased and blood pressure is going to be increased. That's the side effect which is not required. But anything which is called as a drug will, with effect, will have a side effect. One thing I will tell, any drug which is having effect will have a side effect, because we cannot make the drug to go directly to a receptor on a particular organ and act, whereas it will circulate throughout the body, and wherever the receptors are there, it is going to do the action. That's the unwanted action also. That's why any drug which is having effect will have a side effect, and any drug which is not having side effect will not be a drug at all. So please remember, sometimes the homeopathy and many drugs, they are claimed as the very good drugs and say that they do not have side effects. Means if the drug is not having any side effect, then it is not having any effect, and the action may be due to the placebo effect. And adrenaline can directly stimulate respiratory center, but this action is seldom manifest at clinically used doses. And what happens in the rapid IV injection, already we have seen that causes transient apnea, especially it is going to cause transient increase in the blood pressure and transient apnea due to reflex inhibition of respiratory center. So one should be careful. And toxic dose of adrenaline cause pulmonary edema by shifting blood from systemic to pulmonary circuit. So if you administer more and more quantity of the adrenaline, so then what happens? There will be formation of pulmonary edema, because a lot of blood will be flowed to the pulmonary arteries and capillaries, and there is a fluid oozing will be present in the lungs, and this is known as the pulmonary edema. So the eye, what happens if you administer particularly the adrenaline, or suppose in a flight or fight reflex, when the animal suddenly faces some situation which is unwanted for it, then mydriasis occurs, means pupillary dilatation occurs due to the contraction of the radial muscle of the iris. That is due to the alpha-1 type of the stimulation, but this minimal after the topical application, because the adrenaline penetrates the cornea poorly. So to accommodate the light and the situation, to see the especially things very clearly, whenever you are frightened, there is dilatation due to the contraction of radial muscles of the iris, dilatation of the iris pupil, and this is called as the mydriasis. But this minimal effect after the topical application. If it is locally given, then it is not going to cause such action because adrenaline penetrates cornea very poorly. That's what we say, and science has proved it. The intraocular tension or the pressure tends to fall, especially in the wide angle glaucoma. And glaucoma is the one which is accumulation of the ocular fluid in the body. There are varieties of this glaucoma, wide angle glaucoma and short angle glaucoma, etc. So intraocular pressure tension tends to fall, especially in the wide angle glaucoma. And adrenaline has complex effect on the aqueous humor dynamics, especially the aqueous humor, and overall aquification of the formation is reduced and outflow is facilitated. That means it is having a specific and marked effect on the eye. First of all, it's going to cause the mydriasis, then intraocular tension increases, falls, and also the aqueous humor will have some effect. So the formation of aqueous humor will be seen. And of course, it is having many other effects apart from this particular thing. So, the gastrointestinal tract, one of the important tissues in the body that we need to learn is what is the effect of the adrenaline on the gastrointestinal tract. So, what happens? Just imagine that when you are in a fear, lot of fear, and about to run, then what will be the effect of adrenaline on your gut? So, in case of isolated preparations, relaxation occurs through the activation of both alpha and beta receptors, whereas in case of the intact animals like us and man, the peristalsis is reduced. Peristalsis is reduced and sphincters are constricted, but the effects are brief and no clinical importance. So, whenever you are in a very hurry, then the intestinal peristalsis will be decreased, whereas sphincters are constricted. Please watch this in future. And the bladder detrusor is relaxed and trigone is constricted due to the alpha action. The detrusor muscles, I think you know very well about the detrusor and trigone muscles as this time as you already undergone the anatomy classes. So both actions tend to hinder micturition. So whenever you are in what you call as tension or anxiety, then the micturition will be hindered, or it is drop by drop that you might have so many times. If the animals might have also experienced, because if you go to the cattle shed of a farmer and if there is a buffalo, the buffaloes are very much animals with very much anxiety. So a veterinarian goes means they will be frequently micturating because here the trigone muscle will be relaxed, and because of this thing the micturation occurs and the constriction it stops. So there will be frequent micturation. And the uterus, adrenaline can both contract and relax uterine muscles respectively through alpha and beta receptors. That's why many times the pregnant animal should not be disturbed. Otherwise, it is going to cause the contraction and later relaxation, because the uterus has got both alpha and beta type of receptor. And terbutaline, or the beta 2 adrenergic specific receptor antagonist, is the one, a drug administered whenever there is a threatened abortion. This is the basis for the particular thing. Overall effect varies with the species, hormonal and gestational status. So many things are there. But the splenic capsules, it contracts due to the alpha action, and more RBCs are poured into the circulation, more and more RBCs, because more and more RBCs are required for the increased circulation whenever there is a fight or fight reflex. Then the skeletal muscles, usually the skeletal muscles, neurohumoral transmission is facilitated. In contrast to the action of the autonomic nerve endings, the receptor activation on motor nerve endings augments acetylcholine release, probably because of its alpha 1 subtype. The subtype of the receptors especially present on the alpha, this is skeletal muscle, is the alpha 1 type of the receptor, and is going to increase the release of the acetylcholine release, and the direct effect on the muscle fiber of the adrenaline is exerted through the beta 2 type of the receptors and differs according to the type of the fiber, which type of the skeletal muscle fiber. The active state is abbreviated that less tension is developed in slow contracting red fibers. So once again, there are red fibers and the other type of the fibers are present in the skeletal muscles. The action on rapidly contracting white fibers is too prolonged. The active state and increase the tension developed. So this is one of the important action, means the overall action, especially in the skeletal muscle, is it is going to contract and the tension develop, means strength of the muscle, especially for fight and flight reflex. It should be, the animal should be ready with more and more muscle strength. That's why it is made as the tension is increased in the muscle and more blood flow will be there. As we have seen that the capillaries supplying to the skeletal muscles are relaxed and more blood will come. And in the central nervous system, so please remember that whenever the adrenaline is clinically used, if you administer the adrenaline which is available in the ampules, especially it is a life-saving drug and does not produce any marked CNS effect, because it is not going to penetrate into the blood-brain barrier, but restlessness, apprehension and tremor may occur because of the partial cross of that adrenaline through the blood-brain barrier. As a catecholamine, it is not going to pass. The exogenously administered adrenaline is not going to pass the blood-brain barrier, whereas the endogenously, definitely there is action is there. The activation of alpha 2 type of the receptors in the brainstem by selective alpha 2 agonists results in decreased sympathetic outflow, and also the BP will be fall and the bradycardia will be seen. Activation of the alpha 2 type of the receptors, especially in the. So please see here that the heart is controlled by many type of the controls. Number one is the adrenergic receptors, beta, it's mediated by beta 2 type of the receptors, where the force and the duration of the contraction is going to increase, whereas due to the cholinergic action, it is going to relax. And apart from this direct action, the central nervous system also controls the heart through the what you call as the cholinergic nervous system. And the metabolic effect is glycogenolysis, and hyperglycemia, what is called as the hyperlactacidemia, and lipolysis, rise in plasma, free fatty acid or FFA, and its calorigenesis is more because of the action on beta 2 and beta 3 type of the receptor. So ultimately the metabolism need to be increased to cope up with the situation of fight and flight. That's why the catabolism of the glucose and also hyperglycemia occurs, catabolism of the fat and other tissues, and pouring up of the the glucose from the liver will occur, and ultimately hyperglycemia will be seen. These are due to the direct action on the liver, muscle and adipose tissues, as I already told. So the depot of the glucose are present in liver, in the muscle and in the adipose tissues. The first one is the liver, then on the muscle and adipose tissues. So these are the one which are going to release the glucose into the blood whenever there is a fight or flight reflex. And transient hyperkalemia followed by hypokalemia occurs due to the initial phase of the potassium from the liver, and later it is enhanced uptake into the skeletal muscles as well as in the liver. That's how it takes place. And adverse effect and contraindications of the adrenaline, then whenever you administer the adrenaline to a patient to whose heart rate is normal or who is suffering from the shock, then there will be transient restlessness, there will be headache, there will be palpitation, there will be anxiety, then tumor, tremor, and pallor may occur after subcutaneous or IM injection of the adrenaline. So, due to the varieties of the actions and the headache and other thing, the exact mechanism is not known. And marked rise in the BP leading to the cerebral hemorrhage. So, whenever due to the action of the adrenaline on the beta 2, beta 1 type of the receptors on the heart, there is marked increase in the BP, and this causes cerebral hemorrhages. Ventricular tachycardia, fibrillation, angina means there is a pain in the heart. If more and more this is given adrenaline, then myocardial infarction are hazards of large doses of the inadvertent IV injection of adrenaline. So, adrenaline should not be repeatedly given, administered to the animals, so that it causes certain adverse effects on the heart. Adrenaline is contraindicated in hypertensive, hyperthyroid, and angina patients, because in case of angina patients, so there will be already there is what you call as the pain, cardiac pain will be there. Then at that time the adrenaline will increase it more, and also hypertension means already the blood pressure is more. So such patients, the blood pressure will increase more and more, and there is a chance of the cardiac failure. And adrenaline should not be given during anesthesia with halothane. Please see that. So adrenaline is a very common practice that during the anesthesia and other things, adrenaline is given. So it should not be given in case of halothane anesthesia, and because it causes risk of arrhythmia, and to patients receiving beta blockers, especially the adrenaline should not be given during anesthesia and halothane, and to the patients giving the beta blockers, especially beta 1 blocker, which causes, because of this thing, it causes marked rise in the BP, and which can occur due to the unopposed action of the adrenaline. That's how one has to be very careful while administering the